Hi, Dr. Windisch again from Sparks Pediatric and Adolescent Medicine. Welcome to our educational series for parents. Today we're going to talk about something very common with new babies, and that's diaper rash. And boy, is that frustrating. Please remember, these videos do not replace consultations with your doctor. There are things that cannot be diagnosed without seeing your doctor. If you are concerned, make an appointment with your doctor to be seen. We'd be happy to see you here in our office. You can call us at area code 775-359-7111. So diaper rash, we see it a lot. Most of the time it's just caused by just wetness up against the skin, especially in babies in the first month of life. Their skin is so sensitive. So what can you do? Well, the first thing is prevention is key. So trying to air them out helps. Let some natural light hit the baby's bottom. Let them spend some time with the diaper off. Now that's not so easy because these babies don't exactly hold on to things and they've been known to pee all over the place. So you do want to keep them covered as much as you can. Change them frequently. Get them out of that wet, dirty diaper as quickly as you can. If things are really chewed up, I recommend using washcloth and water instead of diaper wipes because they can irritate the skin. There are things you can put down on the skin to help it to heal. Most of these things tend to be greasy. Desitin is very popular. That's a combination of zinc oxide and lanolin, and it works very well as a preventer for diaper rash. You can also use Vaseline. You can use A and D ointment, or bag balm here in northern Nevada is very popular, and those all work very well. What doesn't work well are things like baby powder and cornstarch. And the reason they don't work so well is because once they get wet, then they just turn into glue, and that wet glue just sits on the baby's skin and chews it up. So although a lot of parents like that baby powder smell for their babies, it's not really so good to prevent diaper rash. It definitely doesn't treat diaper rash, and neither does cornstarch, same problem. Because all you have is paste at that point. If your child gets a diaper rash, there are some things you can use to help it to go away. Diaper rash ointments that have drying agents added to them are available over the counter. You can get something called Budreaux, that's Budreaux', or Dr. Smith's diaper ointment. They do both work well, they're very expensive. A not so expensive alternative is Dombro solution, D-O-M-B-O-R-O. It's a powder. Aluminum acetate is the chemical compound. It's extraordinarily cheap, unlike Dr. Smith's and Budreaux's. And you can buy a box of Dombro solution for $8. And a box will contain multiple packets of this dry powder. Take one packet and mix it according to the instructions on the box. Depends on which one you've bought. Here in this office, what we sell to patients, you mix one packet into 16 ounces of water. And take that water, or that mixture of water powder solution now, saturate a gauze with it and stick it on the rash. Put the diaper over that, and whenever you change the diaper, change the gauze until the rash is gone, and you will be surprised how quickly that makes the rash fade. A box of Dombro solution costs about half what a bottle of Dr. Smith's does. One box of Dombro solution, one packet of Dombro solution will last most children a lifetime, and most boxes have 6 to 8 packets inside of them. So, 4 or 5 parents can split one box if you have friends with babies. I bought one box for my son, and I've given packets away to all of my friends who've had kids since then, and still have the original bottle for my son, who is hopefully soon going to be out of diapers. But it makes the rash fade very quickly. If the rash is not getting better, and if it doesn't respond quickly, you do want to see your doctor. There are a couple of infections that can give you diaper rash, and those need to be treated. And they're not so easy to diagnose at home. Lots of people know you can get yeast infections in the diaper area, and that is true, that is very common. But you can also get bacterial infections in the diaper area, you can get psoriasis in the diaper area, and unfortunately certain very rare forms of cancer can occur in the diaper area, and they can look a lot like typical diaper rash. So diaper rash that does not get better with typical treatment needs to be seen by a physician so that we can know for sure what's going on and make sure we've got the right medicine for you, and if that needs to be biopsied, if you need to see a dermatologist, that can be arranged quickly for you. I hope this has helped a little bit and helped to demystify how to care for this very common, very frustrating, very painful problem for babies. If we can be of help here in our office, please give us a call, area code 775-359-7111. We'll see you next time.